Hi, my name is Sydney Nutma, and I will be discussing dice roll number 4 for the social support event. So Maurice's wife suffered from terminal lung cancer, and unfortunately her treatment stopped working, and she has since passed away. But prior to that, since Maurice could no longer provide adequate enough care, he and his wife looked into palliative/hospice care options, and then other end-of-life options such as assisted suicide and euthanasia, because Maurice's wife was highly independent and wanted to look into options such as those rather than going through care programs. So first, to talk about the institution of dying. The institution of dying separates the dying process from the everyday life process and often places older individuals, sick individuals, and then terminal patients into hospitals and care homes or into other institutionalized programs. And dying is often viewed as a medical event rather than a life event in the institutionalization of death, which can lead to increased loneliness, increased isolation, increased over-medicalization, and then increased interventions for patients that are moving into that end-of-life stage. While institutions do play a part in medicalizing death, not seeing it as a life event, they do try to make the process of death more humane by offering specialized end-of-life palliative and hospice services, and then also offering euthanasia and assisted suicide to patients who qualify. What is euthanasia or assisted suicide? Euthanasia is the instance in which a physician or a nurse practitioner, so a qualified healthcare provider, where they directly administer a substance that causes death, such as an injection of a drug to an eligible patient. There's a huge legal process. There's a lot of documents that the individual themselves has to sign, that the medical team has to sign. So it's not just open to anyone to go and get euthanized. There's a huge qualification list that an individual has to meet in order to have this procedure done. And then same with assisted suicide, which is the instance in which a physician or nurse practitioner provides or prescribes a drug that the eligible person then takes themselves in order to bring about their own death. So euthanasia is when the physician does it. Assisted suicide is when the physician gives the individual the drugs in order to bring about their own death. So in 2022, MAID deaths, medically assisted dying deaths, made up 4.1% of all deaths in Canada. And then we've seen a trend from 2019 to 2022 of an increase in MAID deaths. So in 2019, there was around 5,500, and then in 2022, there was 13,241 deaths by medically assisted suicide. Medically induced dying. The stages of death include denial, anger, bargaining, depression, and acceptance. Denial being the first defense mechanism. This includes the denial of a diagnosis, the tests, the competence of the physician, and then avoiding the subject. They've been basically served with a life sentence of imminent death, and so they're going to avoid the topic, because why would they want to think about that? It's an important part of the processing of the information they've just received. This can then move into the second stage, which is anger. So after the reality of the diagnosis hits them, anger can set in. That anger can be focused towards the diagnosis itself, the physician, their family, themselves, potentially a higher deity if they're religious. It could also be generalized anger. They're just angry about the situation, about what's happening to them. They feel an injustice has been done to them. And so then they move into the third stage, which is bargaining. They're trying to gain a sense of control back after receiving a life-changing diagnosis. So the individual may negotiate with the healthcare team, say, I'll do everything on a treatment plan as long as I won't die. Like, I'll do anything you want me to. They might negotiate with a higher being and say, I'll do anything in my life as long as you can save me, basically. The first three stages are often almost used as an emotional defense to protect them from then the fourth stage, which is depression, where they just feel overwhelming sadness and fatigue and the other symptoms of depression as the reality of their diagnosis sets in, as they come to realize, I'm going to die. They have this depression that overwhelms them. But then when they can move on from depression, they move into a stage of acceptance where they come to terms with the diagnosis and accept the reality of it. They accept their death sentence, and then they focus on then spending their time in a meaningful way and then making preparations for their death with their family, with their friends, within themselves, making sure that they are ready and are as ready as they can be. And then talking about some palliative care and hospice care options. Both palliative care and hospice care are great options for supporting individuals with serious illnesses. Palliative care focuses on providing care for individuals with serious illnesses and providing reprieve for their personal caregivers and then family and friends. Palliative care incorporates a team of healthcare workers working to provide the patient with the most effective and easy-to-follow treatment plan for their illness while providing comfort care and seeking to improve the individual's quality of life. Palliative care specifically is focused for people with serious illnesses that are not yet terminal. They still have, there's still potentially an end in sight of their diagnosis or their illness. There's a treatment plan, there's potentially a cure. Whereas then hospice care, which is a form of palliative care, is used when a patient is facing imminent death within 6 months and treatment is no longer working on their illness. So hospice care focuses on, again, providing comfort care and improving the quality of life of the terminal individual, and then also reprieving their caregivers as the individual and their family prepares for end of life. So it's specific to end of life care. Both Maurice and his wife would have benefited greatly from hospice care since her disease was no longer responding to treatments. Her lung cancer was terminal. So a licensed healthcare worker could come in and assist then Maurice in keeping his wife comfortable as she approached death. AHS has many different services that can be utilized for end-of-life care, including home and community care, hospice care, and then grief and bereavement support groups, alongside many other different kinds of groups and supports out there. And then some other supports just within Maurice's own family. He could get support from family and friends, and then even looking to getting like a support animal or something to provide some comfort for him and his wife. And then to discuss the sociological theories. So looking at structural functionalism, it would have focused on euthanasia and assisted suicide and how it fits within the broader social system. So looking at how medically assisted dying gives opportunity to reduce the suffering of individuals inflicted with insufferable diseases, increasing the stability of society as a whole. So when you're able to provide care for one part of society, it helps the cohesion of society in general. Conflict theory plays the devil's advocate more and highlights how the power dynamics, inequities, and then medical exploitation shape the practice of euthanasia and assisted suicide. So it would have identified the possibility of slippery slopes and marginalization of certain groups when identifying individuals who qualify for MAID. So a huge debate about medically assisted dying is the slippery slope argument. Where does it end? Where does it stop? What's the line that this individual qualifies for MAID, but this individual doesn't based on such and such qualifications and whatnot? So conflict theory really looks at that and basically just determines what are those factors that could create a problem. And then symbolic interactionalism shows how different social groups view and interact with euthanasia and assisted suicide based on individual and collective understandings. So then, for instance, the medical field would view MAID differently from individuals based on their understanding and personal relation to the procedures. The medical field is going to look at it as a medical event. The individual is going to look at it as on a personal level. It's a personal event. So then, in general, if I was the individual in this circumstance, I would greatly encourage my partner to look at more hospice palliative care options rather than going the route of medically assisted dying, just based on my own personal convictions. I think that it's amazing that we have hospice care options and end-of-life comfort care, and just seeing the amount of different resources there are within that category brings a sense of comfort already, whereas the medically assisted dying and whatnot can cross some personal boundaries just with moral conviction. But in general, that is my presentation, or my portion of this presentation, so I hope you enjoyed.